Our elected leaders are taking notice. Joining us tonight by phone is Congressman Gary Palmer. Congressman Palmer, thanks so much for taking a few minutes to speak with us tonight.
Happy to do that.
Thanks a lot. We know that you and other lawmakers are working with the president to help Americans get through this coronavirus pandemic. So things are changing really fast with the spread of this virus. What do you think about the federal response so far to contain it and when it comes to testing?
Well, I think that the coordination and cooperation has been unprecedented. I think we have been hampered by bureaucratic rules that have been in place for years that transcend multiple administrations, and I think we're just now beginning to realize the lack of flexibility that we have because of them. And I think what the administration is doing is they're making major changes and giving waivers so that, for instance, to allow doctors to practice across state lines in areas where they're needed. But I think we're on the verge of getting the test kits that we need, and that's going to be the key. We need to test as many people as possible.
We certainly do. What about a push for a vaccine?
Well, that's interesting. There's a couple of things here. One involves UAB and the pharmaceutical company Gilead. They've developed a therapeutic drug that they're convinced will work. Gilead's producing it in mass quantities. They're doing the control group testing right now. We should know in 4 or 5 weeks. We should have those results back, but they're confident that this is going to work. I actually suggested that that the federal government pay Gilead and UAB for the formula so that we could distribute that to pharmaceutical companies throughout the world for mass production and distribution to the people that need it. And what Gilead's doing is, as I understand it, they're giving it to the government and are giving the drug. So I think that's going to help. And the key with that, while it's not a cure, it's more in the vein of, say, Theraflu, it will substantially reduce the pressure on the hospitals. If people can get this and it helps mitigate the impact of the virus, it would and alleviate having to send so many people to the hospital. On the vaccine, there are companies working on that now, and as I understand it, there are 50 people in Washington State that have agreed to be the test subjects. These are healthy people that are allowing themselves to be injected with this experimental drug in the hopes of accelerating a vaccine that could be distributed worldwide. And I tell you, those are 50 courageous people, and it really stands in sharp contrast to the folks that are not willing to practice the social distancing that we need. So I hope this works, and I think they'll be the heroes.
Yeah, we hope that this all works. We know that you're busy. We just have one quick question for you. The economy is a big concern for everyone. Do you agree with the stimulus package that the House passed, or do we need more to keep businesses, especially small ones, afloat and their families?
Well, I do agree that we need another stimulus. We knew this was going to come in phases. The one that we passed in the House that the Senate approved today was phase 2. Phase 3 is coming, and it's going to be, right now I think it's going to be over $1 trillion. I've made a number of suggestions to the key committee members, and I think there's a way to move forward from this, to help people, help businesses, and to have ourselves in a position when we get through this where our economy can pick up where it left off.
Well, great news. Thank you so much. We'll be keeping in touch with you throughout the days and weeks to come. We appreciate your time tonight, Congressman Palmer.